Today, we're going to take a look at addiction and why it often fails in terms of long term recovery. And when we are talking about this, we are looking more towards the areas in which the resources are not readily available for those who have gone through the incredible work to get detoxification and for recovery services. Once they leave those facilities, a lot of times they are left out on their own with little to no resources for them to rely upon to keep them clean and to encourage them to have a much healthier lifestyle. Before we get into this, I think it's important that everyone understand exactly how addiction impacts the human brain. A lot of people look at it as thinking it's just simple willpower, that if people wanted to, they could just walk away from addiction. And this is far from the case. For some lucky individuals, they are able to just stop and walk away from addiction. But for the most, the impacts on the brain and the long term recovery rates are a totally different story. So they take a lot of work. The recovery takes a lot of personal dedication and a lot of bumps in the road as that road is traveled. So let's first take a look here at a video that was actually produced by Yale University and Yale Medicine. And this explains the direct impact in which the addiction takes over the brain. And this is looking at certain types of addiction, but for all addictions, it's very similar. So it's important to understand that before we move forward with looking at the failures.
Addiction is defined as not having control over doing, taking, using something to the point where it could be harmful to you. Previous to understanding the science, it was thought that addiction resulted from a lack of willpower and was a moral failing. But we now know that addiction is a physiological disease. It changes the brain structure in ways that can alter the way it works and process information. To understand how that happens, we start by thinking about reward and the brain's natural reward system. The reward pathway's primary function is to reinforce sets of behaviors. Evolutionarily, it began as a way to indicate to us that actions that help us survive are good and we should keep doing them. This is mediated through a chemical called dopamine. Following an appropriate behavior, the reward pathway releases a small burst of dopamine. That burst of dopamine is a satisfying jolt, encouraging you to repeat the same action in the future. Dopamine will in turn also act on areas responsible for memory and movement, which helps us automatically build up memories for what is good for survival. The problem is that addictive substances hijack our natural reward system. Every substance has slightly different actions on the brain, but one thing all addictive drugs have in common is that they produce a pleasurable surge of dopamine. Addictive drugs all cause dopamine to flood the reward pathway 10 times higher than a natural reward would. Over chronic use, nothing else natural is quite as rewarding. In fact, as substance use increases, the circuits adapt and reduce their sensitivity to dopamine, a phenomenon known as tolerance. For example, let's say a person takes cocaine for the first time. The reward system receives a huge burst of dopamine. But as the person takes more frequently, cocaine will be overstimulating the brain with dopamine. This will cause the brain to adapt to these chronically high levels of dopamine. To compensate and adapt to this new normal, the brain reduces the number of dopamine receptors available in the reward system and releases less dopamine. As a result, that person will feel the need to increase the amount of drug they take so that they can reach the level of high that they're used to. But it's not just the reward system that's affected by this tolerance, since dopamine is also involved in other brain mechanisms. Other brain regions involving decision-making, memory, and judgment also get physically disrupted as a result. The overall effect is to have drug-seeking behavior driven by habit rather than conscious thought, like a reflex instead of a choice. This biological basis helps to explain why addiction really is a brain disease, not a matter of willpower. The stigma that accompanies addiction only makes seeking treatment more difficult.
So there you have it, folks. That kind of gives you an idea as to how the brain is impacted by the addiction. Now, keeping in mind that the further and further someone goes down the rabbit hole of addiction, the less and less they actually utilize other parts of the brain that are not functional or primary in the seeking and achievement of that next hit. Whether it's heroin, whether it's fentanyl, whether it is any other type of addiction material. Of course, that is what they are seeking. There are what people call functional addicts or functional alcoholics, or whatever the case may be. But at the end of the day, the certain parts of the brain that have been impacted are still seeking out that reward in the release of dopamine, and it really is an ongoing situation. This really plays into effect when you're looking at families, friends, and others, even employers and such. When it comes to an individual who is seeking their next hit, whether or not, again, depending on which drug they are addicted to, they will lie. They will manipulate, they will cheat, they will steal, uh, they will rob, they will do all of these things that, although there's certain parts of their brain that would tell them not to do this and to actually, make them have logic about it. Instead, they're focused on the one path, and that is getting the next fix of their drug of choice. So, unfortunately, when you are dealing with someone who is suffering from addiction, you are dealing with the addiction, not the actual person that would have other cognitive thought processes that would prevent them from stealing from family, from lying, from manipulating, from cheating, from so many other things. And they get essentially tunnel vision, and that's all that they are seeing ahead of them is that reward, and that's what's driving them. This also is a reason why things such as their work production really declines, why they are less able to participate in family events or family functions. And that is, again, because that is outside of the path to that reward system. So again, it is a brain impact that it carries. And this is something that can actually trigger a craving or a response years later, even after the person has gone through recovery, that's gone through detox recovery and long-term sustained a nice, clean, healthy lifestyle. They can still have that trigger that comes to their mind and pushes them back. But at that point, hopefully they've gained enough control that they're able to focus on where their life is going, and the rewards that are not the addiction, but the outside rewards, such as family happiness, about employment, about success, and things to that nature. So, again, it is a very, very challenging path. And a very tough path for those who actually take control over addiction and make it through. So this, I hope, gives you a bit of insight as to how the addicted brain works, how the brain chemistry works, and how it changes and is altered by the addiction process. Now, keeping in mind that there are so many places that are dealing with addiction services or those who are addicted, and this is an international problem. It is not just a local Vancouver problem, not a New York problem, not an Oakland, California problem. It is a worldwide issue. And we see it in the Punjab of India and throughout India, actually. We see it in Russia. We see it in Ukraine. We see it in Australia. We see it in Japan, in China. It is a worldwide epidemic. And with that, of course, there are those who are feeding into the system the fentanyls, the opioids, and other such substances that are creating an overdose crisis around the world as well. Now, some countries are way underestimating or underreporting the overdose levels, but believe me, they are there. And even if they are unreported, it's really an epidemic that's hitting all regions and all countries. So let's take a look at an example here in Metro Vancouver. Now, these pictures are from a couple of years back. And these look at the internal and areas of what's known as an SRO, and that's a single room occupancy. And this is very common for not only Vancouver, but other regions around North America and worldwide. Individuals were seeing a very large influx of tent cities, of people on the streets, and people who are really challenged when it comes to finding and obtaining resources for recovery. Now, this SRO that I'm showing you is one of the worst that I've toured and looked at. Now, this one here is again in downtown Vancouver's downtown east side, which is one of the worst communities in terms of poverty and addiction in Canada and potentially North America. But if you look at this particular image, this is actually a room that is in the middle of other rooms in the SRO. So you've got other units that are occupied surrounding this room that is just filled with trash, with garbage, with rats, cockroaches, you name it. The mess in this area is just disgusting. And yet there are people living within, on the other side of this wall, there's another unit. So the rats, the cockroaches, any type of airborne particulates, they're flowing throughout this facility, and it is just disgusting. Now, of course, this is a building that is an SRO. It's a low income, single room occupancy. And unfortunately, that is a lot of people can only afford to rent a room in the city of Vancouver. It is a very expensive place to live. Now, if you couple that with addiction, of course, you're going to see where people start to live not only in these facilities, but also people that are on the streets that refuse to go into shelters and SROs. This is a very clear reason why so many turn down that opportunity or that option. And, people that haven't seen these SROs and the conditions in some of them and the shelters really don't understand the complexity and the concerns that people have by entering these facilities. Now, in this particular facility, you can see that a lot of windows lead to a center, almost a courtyard area, but it's a roof of the building below. And down on this area, you've got garbage. You have used personal care items, we'll put it to not gross people out, condoms, syringes, used syringes, rubber gloves that have been used for who knows what. So again, this is just thrown out and left there. Again, when you have animals and such around, of course, they could be coming in contact with this as well. So the next image that you're looking at here on the screen is one of the hallways. Now, this is one of the cleaner hallways that you're seeing here. But again, there's a kitty litter box in the hall that doesn't actually have kitty litter in it. It's got still water and cigarette butts, syringes, among other things in it. It's just disgusting. There are used syringes throughout this building, on the stairs, on the floors. There's blood. just a lot of biohazardous materials that people could come in contact with. And when you consider someone who's gone through the struggle and the battle to actually check themselves into detox and successfully complete that, and then they proceed to recovery, they are doing well. But now they're time to get back out of the recovery facility or the health treatment centers, or even the private facilities. The time has come. Now they only have, and this may not apply to all, but this applies to a large volume of people, that they don't have the resources to go out and rent a $3,000 a month apartment in Vancouver. So they're back into these SRO units, the single room occupancies. And again, they are going back into an environment in which is not safe. It is full of triggers that are going to push them to want to use again. And it makes the pathway forward for long term sustained recovery and being clean, it makes it very, very challenging. And how do you expect to take people who have gone through that battle, put them back in the same environment where they're full of the same triggers, where there are people literally openly using and being injected in the neck? Right there in the lobby of the building, in front of security that's doing nothing about it. They want to talk about safe injection sites and safety, the person not overdosing in a room, which does happen quite often. But again, if you look at the sanitary and humane or inhumane conditions of these facilities, it's no wonder that the failure rate is so high when it comes to recovery and long-term sustained healthy living. Now, as you can see, this is one of several things in the hallway. Again, this is full of butts and syringes, blood, all kinds of crap in this water. It's disgusting. You can see up on the ceiling line there, there's wires running all over the place, just, incredibly unsafe conditions. And they wonder why there's so many fires in these facilities that are causing injuries and potentially, death traps to those who are residing in these SROs, whether or not they are currently and actively addicted or if they are trying to move forward with recovery. It is not a place that is safe or suitable for human life, let alone, people that need extra support and encouragement. Now, the floors, of course, have got blood on them. They're filthy dirty. You can see that everywhere you look, there's patch holes that have been damaged. The filth, even in the public areas, is just disgusting. In this image, you can see the stairway. There's dried blood on the stairs. There's, just absolutely no maintenance and care. You can see down on the floor at the bottom step, you can see a used syringe that is just laying out in the open. The incredible inhumanity is just on full showcase here. And this is not isolated to Vancouver, although that's where this one is. Again, it's not isolated to Vancouver. And you must ask, where are the tax dollars going that are paying for these facilities? Why are we not demanding that if our tax dollars are paying for these locations, that they are not being maintained in a humane and safe manner? You can see they have security cameras on the walls, which really, I think, are really useless. It's like putting a Band-Aid on an open wound that needs, 150 stitches, and you put one little Band-Aid on it, it's not going to do anything. And again, here's a look at that room again, where on both sides there are other rooms that are being utilized by residents. This is disgusting. As I said, there's rats, there's fleas, there's flies, there's cockroaches, used condoms, and just all kinds of trash buried in here, along with clothing and the unsanitary conditions. I mean, why, if you came out of a recovery center, why would you want to subject yourself to all of these triggers and this disgusting, inhumane facility to live in. And, people don't have other options in many cases, and this is how they end up back in that same cycle. Now, here you can see out on the street in front of the building, people are openly using, and this gentleman has just shot up. He's now on the nod. And just right there, people have to step over him in order to get to the doorway of the facility or step around him to get into the SRO. So, again, it is not at all conducive to a recovery or to any type of humane living for even people who are addicted. They are still humans. They are still somebody's son, somebody's daughter, somebody's mother, father, brother, sister, whatever the case is. They are still a part of our community. And someone once said that you judge a society on how well they treat the most vulnerable. And as you can see, the society here in Canada and in other communities around the world is definitely failing, because if this is how they treat the most vulnerable, it is a testament to our failure as society. If we want to look at supporting long-term recovery and long-term impacts, then we have to eliminate these type of facilities. Not to mention that if you are addicted to heroin or fentanyl or anything else, and you're residing in a facility such as this, and you think, okay, if I make the transition, if I get to a detox center, if I can get a bed at a recovery facility, and I can get to a clean, healthier style of life, knowing that you're coming back into this sort of environment is not going to give you the hope and the destination or the destiny reward that you're seeking. Again, you're not seeing a future of any type of increased self-esteem or any type of self-pride. Instead, you're seeing yourself coming back to the same cesspool that is these SROs, and that just is not encouraging people, again, to go and get help. Now, a lot of people are living in tent cities. The streets are full of them. There is crime rampant in these areas. The businesses basically have to shutter because the general public do not come to these locations in these areas. It is a cesspool of dirt and grime and disgusting areas. But again, why would they want to leave a tent city? At least in their tent, they can control somewhat the environment they're in, whereas in these SROs, just full of ongoing drug use, crime, victimization, and so forth, it just doesn't really encourage anybody to want to get off the streets and go there. Um, it really is a tragedy on how we're doing in relation to encouraging recovery, encouraging addictions in terms of safe injection sites. Again, I see the pros and the cons of safe injection sites. I see the benefit of clean needles, not spreading HIV, hepatitis, and other things for those who are suffering and addicted. For those users, I think that the impact on the healthcare system definitely outweighs the cost of the safe needles and such. Again, it's preventing a lot of strain on the healthcare system in the long term. But what are we doing to really support those and to reduce the numbers of overdoses, to reduce the numbers of those who are addicted, to reduce the impact on our healthcare workers and our first responders who have to deal with this day in and day out? And I don't care how strong you are mentally, if you are a first responder and all that you are seeing is the overdoses and the lowest of low in terms of society's helping of these people, then of course it's going to take a toll on the mental health of those first responders. Now, we could go on and on about the other various ways in which the system is failing, but we will just cover a couple of more brief points in order to keep the show under a a certain length of time. But we do have other episodes. Don't forget to watch. We've looked very much in depth at the opioid crisis, at the involvement and responsibility and liabilities of the Sackler family and Purdue Pharma. And we've also looked in depth at the impacts on the economy, on first responders, and many other areas of addiction and health services. So feel free to watch on truecrimeandjusticetv.com to find other episodes in this series, but also other true crime and justice stories as well that you may find of interest. But let's take a look next at the family supports for those who go into treatment and those who go into incarceration. Now, incarceration in prisons, in jails, is a real life risk that people utilize or people take, when they are either addicted to drugs or dealing and preying on others. Now, if the system is not encouraging rehabilitation and offering the proper emotional, psychological, and health resources, then again, they are only perpetrating a disservice on those individuals, because when they do release them back onto the streets, they have not learned how to cope with or to avoid triggers and the addiction. And quite likely, they will go back to the addiction cycle. Keeping in mind also that when they are released from such secured facilities, they are just dumped out on the streets without the financial supports or other supports that are going to give them any chance at success. Now, when we look at the other areas of recovery, and when you look at prevention issues, so supporting parents and communities in the areas of substance abuse mitigation and reduction. When a youth or a child starts to experiment with certain substances, whether it's marijuana, whether it's alcohol, whether it is, other drugs, it's important that parents have resources and the ability to reach out and get help for their youth or their child while they are young. The younger you can intervene, or the earlier you can intervene in the addiction cycle, the more success you can have at the damage that is done to the brain that we've already covered the impacts of. When you look at drug addiction and recovery, you also need to look at those who are self-medicating. People who have suffered certain traumas in their life, certain abuses, certain events that they are trying to numb themselves from, that they're trying to not think about, that they are trying to cope with. And when it comes to supports for mental health, whether it is psychologists, psychiatrists, counseling services, and so forth, there is a lack of available services to the general public. A lot of them are very costly. And when you look at families or individuals who are on a lower income scale, that is very difficult for them to achieve and to get those help and support mechanisms in place for anyone, whether it is their child, their teen, or young adults or others. And again, it is a roadblock to a successful transition from using and becoming addicted, or going from being addicted to recovery. So again, you have to look at the holistic approach to treat not only the addiction, but also the underlying causes for that individual. Not everyone's addiction cycle or reason for use is going to be the same. Each individual is just that, an individual with their own circumstances, their own lived experiences, and those need to be taken into account when looking at a totality of service opportunities or services offered for long-term sustained rehabilitation and a pathway forward to a healthier lifestyle. So I hope that this information helps. I hope that if you or someone you love is in the depths and the cycles of addiction, that you reach out, that you talk to somebody, that you find the resources available. Looking on Google or in local directories, you can find resources that are available to you. You can also reach out to your physician and other healthcare providers in your community to find out what services are available. And don't forget that if you are a parent or a family, a close friend of someone who's dealing with addiction, there are support programs available to you as well to help you to cope with it, because it's adding a lot of stress and a lot of mental health pressure on you as well. So, once again, if you or someone you know is in need of services, make sure you reach out to your local healthcare facility, your doctor, other healthcare providers in your community. For that, I am James Kuzno, coming to you from the ProPix Canada studios in Vancouver, British Columbia for True Crime and Justice TV. Please watch former episodes, current episodes, and don't forget to like, follow, and subscribe so that you can be notified of future episodes. Make sure that if you have a story idea or if you'd like to comment on what you've just watched, feel free to add those in the comment section below, or you can email ProPix Canada, PROPICS Canada at gmail.com. Take care, everyone. Stay safe.